I'm Angela Hernandez, and happy Donate Life Month. I'm with Ochsner Health, and today we're going to be talking about some of those myths and misconceptions that come. So I'd like to introduce BreakCon today. First off, thank you so much, Doctor, for coming. Can you give us
plant surgeons. I actually do liver transplantation, kidney transplantation, as well as pancreas transplantation. As part of that, I'm involved with evaluating potential donor organs for transplant. I also perform donor organ procurements, and then I'm part of the multidisciplinary team that includes other doctors like hepatologists and nephrologists, as well as an incredible nursing team that both evaluates potential recipients as well as provides care to the transplant recipients after transplant.
Awesome. So I know today we're going to be getting into all these myths and misconceptions. So can you tell us if someone donates their organ, the first one that I came across was that the hospital staff won't work as hard to save your life. Is that true?
That is not true. So, whenever a patient's admitted to the hospital, the primary responsibility of the medical team caring for them is to provide that patient with the highest level of care. Donation really doesn't occur unless all other interventions to facilitate the patient's recovery have been considered and exhausted. So in the case of these patients, patients who have had a catastrophic brain injury, have been declared brain dead, or when death is considered imminent, it's actually federal regulations that require referral to organ procurement organizations. And these are the organizations that help separate the responsibilities of organ donation from the responsibilities of the primary care of the patient. So there really isn't as much of a conflict of interest there. All of these organ procurement organizations are nonprofit organizations. And again, they assist with both educating families, discussing the options for donation with families, and then facilitating the donation process.
Okay, and some people might be concerned because they might feel that it might be against their religion. Is this something that someone should be worried about? Can organ donation be against someone's religion?
Generally not. Essentially, every major religion in the U.S. Has acknowledged that donation is really a morally and ethically acceptable thing to do. In fact, there are a lot of religions that have made public statements that acknowledge that being an organ donor is really a noble and charitable act. And facilitating that to help save the lives of others is something that is supported by many of the religious communities.
Okay. And can someone under the age of 18 become an organ donor? Can they make that decision on their own? Is that something that the parents have to do? How does that work?
So essentially, anyone of any age can be an organ donor. To register to become an organ donor, individuals can only register if they're above the age of 18. But individuals under the age of 18 can still be donors if that circumstance arises, but it does require the consent of a parent or a legal guardian.
So in that case, would it be the parents that are making that sole decision, or is this also something that's spoken with the child or the minor?
Generally, in the setting of organ donation or deceased donation, those are going to be conversations that are held with the parent or legal guardian because the patient probably isn't really able to have those discussions. So generally, that's who those conversations occur with.
Gotcha. And so for deceased donor donation, some people might be concerned as to if they can have an open casket funeral. Should that be a concern?
It really shouldn't be a concern. I will say that from the standpoint of the donor process, really each donor is treated with the utmost respect, honor, and dignity, acknowledging that they're really providing a gift to other individuals. As part of that, care is taken as far as the organ procurement operations to ensure that an open casket is generally able to be an option for the donors.
Okay. And can someone be too old to donate? Like maybe their organs just aren't probably in the best, healthiest condition. Is that a concern for some people?
There's really no age restrictions on registering to be a donor. Actually, the oldest donor that's recorded in the United States was 93 years old. Really what happens is at the time that a potential donor is identified, outside of age being, an individual strict criteria, it's the work of the organ procurement organizations and in conjunction with the transplant centers to evaluate the health of that donor's organs and the suitability of those organs to be transplanted. And age alone is typically not a restriction.
Okay. And what about if someone's not in the best health? Can their organs still be donated, or is there some type of screening process that takes place?
Yeah. Again, anyone who has any sort of medical history is still encouraged to register to be a donor. And again, at the time of donation, each of these donors will be evaluated in a thorough manner to determine what organs might be donated, whether those organs are suitable. And ultimately, the goal is to ensure that those organs can provide a good outcome to a recipient.
And how long does that process kind of take in the event like someone needs a transplant immediately? Are those, do those tests or screenings like happen very fast, or could they take some time?
So once somebody is identified as a potential donor, the screening or the evaluation process that's undertaken by the organ procurement organizations is something that happens generally very rapidly within a period of hours to days. The organ procurement organizations are used to undertaking this evaluation process as they've been tasked to do it throughout the country. So they're able to do that rapidly. It's a very protocolized approach. And the transplant centers are also able to evaluate those organs once they're offered in a very rapid fashion.
Okay, and I see that we do have a question from the audience. Someone asked, can you donate if you have CFS or multiple immune issues?
So the specific, I'm not exactly sure in this case what CFS is, but again, taking into consideration all of the patient's medical history, not just an individual thing, can dictate whether an organ can be donated. And there are different restrictions that impact different organs differently. So in some cases, having a medical history that may impact the ability to donate one organ may not impact the ability to donate other organs. So that's again why we encourage everyone to register and allow for the evaluation should that person become an organ donor.
And that's interesting. I just thought of a second question. When someone is a deceased donor, are all of their organs used for donation, or it just might be whatever is needed at that moment?
So generally, the goal for each organ procurement association or organization is to really optimize, all of the available organs. We have an incredibly large waiting list in the United States with over 100,000 people waiting for an organ transplant. So the organ procurement organizations are really tasked with optimizing the donation process. So for each individual donor that's evaluated, each organ system will be evaluated. And in some cases, all the organs can be donated. In some cases, only a portion of the organs can be donated. But the onus is on the organ procurement organization as well as the transplant centers who are evaluating these organs to ensure that any organ that can be transplanted is.
Awesome. That's good to know. I always wondered about that. And then speaking of donating organs, when it comes to being a living donor, I had seen that in the past, donating a kidney was only allowed for maybe like an immediate family member. Is that still the case?
That's not the case, actually. Things have really evolved from the standpoint of living donation. Here at Ochsner, we do both living kidney donation as well as living liver donation. And individuals can donate to a family member, they can donate to a friend who's in need. And there's also the opportunity to be an altruistic donor where the donor hasn't really necessarily identified a potential recipient, but would like to help somebody else in need.
Okay. Another common myth is that people believe that maybe the rich and famous, because of their status, they're able to get to the top of the waiting list. Is that true, or how is that handled?
So the matching of deceased donors with recipients is really, a protocolized process that's facilitated by a government associated agency called the United Network for Organ Sharing. So again, this is a nonprofit organization that really serves as the nation's organ transplant system. And UNOS, as this organization is known, has policies and a complex computerized system for matching transplant candidates with donated organs. And again, as I mentioned earlier, our goal is to optimize the use of organs. And so these matching systems are used to facilitate saving as many lives as possible with the allocation process, while also providing for good outcomes for the recipients. So there's really no way to get around these matching algorithms that are used by UNOS in conjunction with the organ procurement organizations and the transplant centers. And each matching process is a little bit different for each organ, but all of them include factors specific to both the donor and the recipient, and then other factors that include geographic considerations from the standpoint of whether the logistics of doing donation and transplant are feasible. But all donor organs are matched through this process. There's no matching that occurs outside of this in general.
Okay. And if someone is looking to be a donor, is there some type of charge that is incurred?
No, there's really no charges at all to the donor's family. Donation is it's an altruistic act that serves to save others' lives, and there's no costs that are incurred by doing it.
Okay. And I know you kind of touched on this a little bit earlier, but if someone is in a coma and they're a registered organ donor, how does that work?
Mm-hmm. So I think the important thing is to realize that there's a little bit of a difference between a coma and some of the circumstances that we're talking about right now. So the majority of organ donors, around 80%, are people who have been declared brain dead. So they've had a catastrophic brain injury and their brain is no longer functioning. That's significantly different than comas, where a coma has the potential for some recovery. And in this setting of organ donation, one of the key tenets of donation is that really all the options for having a meaningful recovery have been exhausted, and any additional care is really thought to be futile. And it's in those circumstances that donation can occur. In the setting of a coma, there is a chance for recovery, and so therefore, generally, organ donation does not occur.
Okay, good. Thank you for clearing that up. My next question are people from the LGBTQ plus community, are they able to register as donors as well?
Absolutely. There are no policies at all or regulations federally that prevent them from registering to be a donor. I think, along with the other kind of groups of people that we talked about, and, with regard to age or medical history or any other factors, really everyone is encouraged to register to be a donor, and each individual donor is treated as an individual as part of the evaluation process. And really the the fundamental piece of the evaluation is just assessing which organs are healthy for transplant. And, being in this community doesn't really necessarily affect that. So it's not a barrier to donation at all.
Okay. And are there any factors that people who should consider when they are making this decision about being a registered organ donor? Are there some factors that they should take into account or things that they should do?
I think that honestly, in my opinion, most, if not all people, should feel comfortable registering to be an organ donor. I've met with hundreds of donor families throughout my time as a transplant surgeon. And, really these donors are thought of as heroes for their patients, and they do save lives. And I would say, for a lot of these donor families, the process of becoming an organ donor is oftentimes in the setting of, a tragedy where a loved one has undergone a catastrophic event. And I think for most donor families, the ability of their loved one to be an organ donor can provide comfort in that situation. And most donor families, I think, really appreciate the opportunity to have their loved ones be a hero to others.
And so how can someone sign up to be an organ donor?
There are a couple of different ways that you can sign up. One of them is just, at the Department of Motor Vehicles when you get a license or renew a license. Another opportunity to sign up, which is quite easy, is actually just going to our Ochsner website, which is ochsner.org/save9. And there's a link there. There are opportunities to register both as a donor in the state as well as nationally. And I think it's worthwhile to do both of those if you're interested in being an organ donor.
Okay, and for my final question, we're in National Donate Life Month. So I wanted to know, what does donate life mean to you as a transplant surgeon?
So, I think a lot of times in the setting of donation, people talk about providing the gift of life. And I think that's really true. And that's what these donors are doing. As I alluded to, each donor is really thought of as a hero from the standpoint of the recipients. And I think, transplant recipients really acknowledge the fact that somebody else has made a significant contribution to saving their lives. So I think donate life really sums up what a donor does, and that's giving the gift of life to a transplant recipient.
Awesome. Well, I believe that's all the time that we have for today. Thank you so much for clearing up all these myths and all these misconceptions. I definitely think we left here today with, a lot more understanding of how this process works. So thank you so much, Doctor, for being here with us today.
Absolutely. Happy to.
And thank you so much to all of our viewers for joining us today. If you have any remaining questions, please make sure to leave them in the comments below and we'll make sure to get them answered. But before we go, did you know that 90% of US adults agree with organ donation, but only 60% have signed up? To learn how you can save up to 9 lives, please make sure to visit ochsner.org/save9. And to stay up to date on all things transplant here at Ochsner, please make sure to follow the Ochsner Multi-Organ Transplant Institute Facebook page. Thank you, and I'll see you next time.